total, 795 have been monitored. Now, those 2 individuals that tested positive remain in isolation at this time. Despite these cases, the overall immediate threat to the public remains low. With that said, we do anticipate that more will test positive, and we have taken additional actions to help contain the virus's spread. Last night, I issued an executive order establishing the Department of Health under Dr. Rivke's leadership as the agency responsible for the response and coordination of the relevant state agencies for the COVID-19 response. In the order, I also directed the Department of Health to declare a public health emergency to better equip our state with the resources needed to handle this threat. The public health emergency ensures that healthcare providers, hospitals, and labs immediately report all suspected cases to the Department of Health. It also advises individuals of the proper protective measures that need to be taken regarding the possible exposure to COVID-19. Now, individuals that have traveled to an area that the CDC has issued a warning level 3 or alert level 2 travel health notice, or those that have been in contact with someone who has traveled to those places, should immediately contact the Florida Department of Health upon developing symptoms. These symptoms include fever, cough, shortness of breath, or difficulty breathing. Current countries at a level 3 travel health notice include China, Iran, South Korea, and Italy. Japan is at an alert level 2. As many of you know, there have been extensive restrictions regarding travel from certain parts of China. We believe that there will be more restrictions in terms of Italy that the federal government is going to undertake. That would obviously be helpful for us as we're looking to stop the spread of the virus. The public health emergency also advises individuals who believe they may have been exposed to COVID-19 to contact their local county health department prior to traveling to any physician's office, emergency department, hospital, or urgent care center. If you look at this virus, the vast majority of people who acquire it will not require hospitalization. And so if you work through your local provider or county health department, rather than showing up at an urgent care center, that will help with the resources for other needs. And I've also asked Dr. Rivke's to work with Health Secretary or ACA Secretary Mayhew to ensure that our assisted living facilities and nursing homes are taking adequate precautions, particularly those who will be have entry to those. If you look at how this virus has unfolded, folks who are middle-aged, younger, healthy, tend to weather it fine. It tends to have a most deleterious effect on people that have either underlying health conditions or that are elderly. So we believe that that's a priority, and they're going to be working in conjunction with those facilities to ensure that their residents are protected. The Department of Health, under Scott's leadership, has been fully engaged from really the beginning of January with their response and epidemiology teams working on this issue. The Department of Health is now able to test for coronavirus here in Florida. Labs in Tampa, here, Jacksonville, and Miami can conduct the tests. This allows test results to be available within 24 to 48 hours. Currently, CDC is taking up to 5 days for results. Obviously, they have a lot of testing that they're having to do. We have an incident management team in place, and we're working in lockstep with the CDC, receiving multiple updates daily. Hundreds of dedicated DOH professionals are responding, including staff in Tallahassee Central Office and in each of our 67 county health departments. We've also engaged the medical community through correspondence and weekly calls and have established a DOH website related to COVID-19, www.floridahealth.gov/COVID-19. This is the best and most up-to-date source for information and guidance regarding the virus in Florida. State of Florida is fully committed, doing everything we can to respond to the COVID-19 virus. I have spoken with both Senate President Bill Galvano and Speaker Jose Oliva. I'm working with Dr. Rivke's and Dr. Robertson about any immediate funding that we may need, and mostly we're talking about personnel, and they were receptive to work with my office to make sure that the needs are met. So I would just tell people, the risk remains low. Please heed the advice of the CDC and local healthcare professionals. You hear some of the things about washing your hands and not touching your mouth and your nose and your eyes. I mean, that really is the best way to make precautions here. And I think that we're working diligently to, and Scott will go in a little bit more detail, I think, on some of the things that are be doing specifically. But our goal is to contain this and make sure we're ensuring public health. So with that, I'll let the doctors come up and say a few words, and then we'll be happy to answer any questions you guys have. Scott?